Let's talk about light therapy for human health. I'm sure people on the call have heard of red light therapy by now because it's a pretty big trend right now on the health blogs, and especially for skin and wrinkles and things like that for women. But it's effective for men and women. And the benefits of light therapy go beyond red light, as I'm sure you've heard of near infrared light as well, because the quote unquote red light devices often include near infrared light options too, but there's other light wavelengths that are healing as well, like blue and purple and green. So different light colors have different wavelengths, and those different wavelengths have different impacts on biology and physiology. And we've discussed this in previous videos, but I want to go over it again today and combine some of the various things we've covered in previous videos into one video. So if we look at the light spectrum here, we can see the solar spectrum, which is the light that comes from the sun, is made up of both visible light and invisible light. Now, the visible light spectrum makes up 39% of the solar spectrum. The ultraviolet end, which is invisible, makes up 7%, and the infrared end, which is also invisible, makes up 54% of the solar spectrum. Why is this important? Well, because each of these sections of the solar spectrum providing light can provide healing benefits. And so let's go to the next slide here. If we start down here, well, if we start with the obvious one, right? Visible light. We all understand what visible light is because that's what we can see, and that's the rainbow, right? Roy G. Biv, if we're moving this way. And so far, the most well-known version of visible light used for human health is red light therapy. And as we've talked about in previous videos, red light therapy ranging from 600 to the 760 wavelengths is used to help with skin, help with inflammation, help. There's research looking at it, some for vision. There's all kinds of uses for red light. Okay, but red light, the visible light that you see, red light does not penetrate very deeply. It is more of a superficial treatment. Okay, so that's why a lot of the red light therapy is focused at the skin, and you see things available on the market like masks for say rosacea or for acne or for um, eczema, different skin disorders. Okay. When you move to the infrared spectrum, which you can't see, okay, you have near infrared and far infrared, but it's the near infrared that is very healing and useful for human health. And that near infrared spectrum is you're looking at the 800 end, okay, 800 to 810 is the really beneficial wavelength from a near infrared standpoint. One reason for that is because near infrared light will increase melatonin production. Okay, and I know you're thinking melatonin and you're thinking of sleep, and it can be helpful that way. But most of the melatonin used for sleep is made by the pineal gland, okay, which is a little gland in your brain that makes melatonin to allow you to motor down and go to sleep. But pineal-derived melatonin is only 5% of the body's melatonin. The other 95% of the body's melatonin is made in the mitochondria. And if you've been present on other videos, the mitochondria are the organelles in our cells that are the powerhouses of our cells. Okay, these make ATP, or adenosine triphosphate, which is the energy currency for our bodies. The mitochondria also, like it says here, make 95% of the melatonin in our body. And whereas the pineal melatonin drive sleep. The 95% of melatonin derived from the mitochondria is one of the most potent antioxidants we know. Okay. And so we've made videos on this in the past, but this is a very, very powerful anti-cancer molecule, melatonin is. Okay. And then other antioxidant effects, help with detoxing toxins and cleaning up damaged cells and promoting overall health. And again, healthy mitochondria yield health overall, yield longevity, yield healthy brain and heart and muscles and adaptation to things we're doing to train those organs. So the near infrared spectrum, part of its major benefit is driving mitochondrial health and driving melatonin production, systemic melatonin production, not necessarily the sleep side. And that near infrared light is the deep penetrating light. So if you've got an issue that's deeper than skin or deeper than about a centimeter deep into your body, then you want to switch your machine over to the near infrared light away from the red light because the red light's not going to get deep enough for you. So switch over to the near infrared, and now you can get deep. You get deep into the body, impact those mitochondria, impact the blood, impact tissues, have a better therapeutic effect on what you're trying to accomplish. So that's the near infrared light. And then all the way over here on the ultraviolet spectrum, we have UVA and UVB. In previous videos, we've talked about the benefits of these. UVA, remember that they teach, the mainstream media teaches us that ultraviolet light is bad, right? It will cause cancer. Stay out of the sun, all of that. In a previous video, we dug into that and dug into the research, and we showed that that's not true, okay? Bad sunlight exposure at bad time of day is bad, but good sunlight exposure at the good times of day is very beneficial. And we dove into the ultraviolet spectrum and we said and showed the research that UVA light is very beneficial for cardiovascular health because UVA light promotes vasodilation or dilation of your blood vessels, so better circulation and blood flow via making nitric oxide, which is our best vasodilator. So it's very heart healthy, vascular system healthy. The ultraviolet B light hits the skin, and in the skin, we've got a molecule called 7-dehydrocholesterol. All right, and that 7-dehydrocholesterol can go one of two directions. If you've got skin with 7-dehydrocholesterol levels and absence of UVB light, then that 7-dehydrocholesterol becomes total cholesterol, and the cholesterol level in your blood goes up. If you've got skin plus UVB light, if you've got UVB light hitting the skin with 7-dehydrocholesterol, then that 7-dehydrocholesterol becomes vitamin D. And this is the mechanism by which the sun creates vitamin D in us. It is that UVB light exposure. So if you stay out of the sun and you cover up with UV blocking sunscreens and clothes and all of that, then you're not getting beneficial UVB light to drive your 7-dehydrocholesterol to vitamin D. So double whammy there. You're going to have an increase in cholesterol, which may or may not be a problem, depending on the individual, but you'll also have less vitamin D. And if you have less vitamin D, then you're losing all the Swiss Army knife benefits that that vitamin D gives us, like antiviral, anti-inflammatory, dopamine signaling. So that's mood and motivation. Okay. Bone health, muscle health, kidney health, immune balance, all kinds of benefits from vitamin D. There's actually 2,800 genes in the body that vitamin D interacts with. And so if you don't have optimal levels of vitamin D through optimal UVB light exposure, then you're not going to have optimal genetic expression and you won't be optimal you. Okay, so we need sunlight exposure. And as we've talked about in the past, quickly, there is a difference in healthy sun and unhealthy sun. So if we've got healthy morning sun shining this way on this shadow, this character, then we'll get a shadow going this way, which is taller than the stick man. Okay. If you have unhealthy midday sun right overhead, that's shining down on this guy and his shadow is small. And then if you get healthy evening sun, it's shining this way on this guy and he's got a nice long shadow going that way. So the healthy sun exposure is when your shadow is taller than you. Unhealthy sun exposure is when your shadow is shorter than you. And so that's how you can know what time of day should I be allowing myself to have ultraviolet light exposure and what time of day should I be covering up and avoiding sunburns from that light, which can contribute to cancer. So typically, depending on where you are in the world, you have to know, okay, where's the sun at its peak at this time of day, this time of year? That can be hard to figure out. The best way to do is instead of looking it up on your phone, look down at the ground and look for your shadow. If your shadow is taller than you, you're good. Easiest way to do it. And so those are the major therapeutic wavelengths of light that are currently used. Now, there are other products on the market that have blue light and green light, and they have use for post-surgical wound healing and things like that, but they're not as broadly used yet or widely available. So we're going to keep our focus here on red light and ultraviolet light today and near infrared light. And so I hope this is eye-opening for you and helps you understand that those ads you're seeing for red light devices are not woo-woo and kind of voodoo, if it seems that way to you. There's piles and piles of research behind light therapy and what's called low-level laser therapy or LLLT. There's or photobiomodulation. There's different names for all this, but it's all the same thing. It's using light to impact our physiology. And so if you're looking for a device, you want to get a device, there's certain amount of power you want and amount of joules you want to deliver to the skin each treatment. The joule is the metric that they measure light exposure to the skin as. And so you want to get about 25 joules of exposure per treatment to get the best therapeutic effect. And so with a good device with enough power, that's about 20 minutes exposure a day. Do some research online to figure out what companies are good and the power that they have and what wavelengths their devices are using so that you can match the wavelength to your desired outcome. Let's open this up for questions.
When you said joules, the 25, is that for the red
Mhm.
light or is that for the
That's for
the
the
near infrared?
both. Yep.
Both. Okay.
Good question.
This is perfect timing because I asked for red light for Christmas.
There you go. Well, what you'll notice, I have um, medical grade lasers that have red light and near infrared light, and what I've noticed is the near infrared light, because it's higher wavelength, delivers more energy faster than the red light. So if you're trying to get the joules, you'll get the joules faster or a faster treatment time, say with near infrared than you would red. But again, if you're using both, then maybe you do 10 minutes of red and 10 minutes of near infrared, or, if you've got time, do 20 of both. It just depends on what's going on. Like I can set mine up at home and, this weekend, my bicep tendon was sore from some, doing too many pull-ups in a workout. So I sat there and watch football and just had my lasers on my bicep tendon. And when you're watching football, time passes fast. So I look over and I'm like, oh man, I've done 40 minutes already, you know? So if you're sitting in front of your panel or your device while you're reading or watching TV or doing something else, then it's easy to get a good dose.
Okay. Is it possible to do it too much or for too long?
Um, for most people, not really. If we're talking about brain disorders, if someone's got an inflammatory, so there's a lot of research on red light and near infrared light for concussion and traumatic brain injury. And if someone's had a concussion or traumatic brain injury, they've already got brain inflammation going on. And so using red light can part of how it works is it increases a genetic transcription factor called NF kappa B or nuclear factor kappa B, and this leads to inflammation production. And so if we've got an acute head injury, we probably don't want to use red light first because you might add to the inflammation. So those people would use near infrared light first. And then as they heal and the inflammation goes down and they've got more integrity neurologically, we can move to red light.
Dr. B, can you
That's,
talk to like how that made you, like what you felt after? Did you feel something good after the treatment right away, or is it more time lapse, or how does that work?
yeah, good question. So um, you may or may not feel a difference. So that's person specific and kind of what's going on in your case. So, for example, there's a place in Charlotte called iCryo, and I don't get anything from them. I'm just naming them because they're a place I've been and I can say their name. But they've got one of those red light, near infrared light, basically tanning beds. So you can go in and you strip down to your skivvies and you lay in the it's essentially a tanning bed, but it's red light and infrared light, and you're getting 15 minutes of your entire body blasted. And so I went and did that, and I couldn't tell a difference, but I know it helped me. I have a patient that does that, and they can tell a very noticeable difference in their energy immediately following and for the rest of the day.
Hmm.
So much so that they do it, you know, more than 10 times a month. So it just it depends on the person and what's going on. And if you notice a difference, it doesn't necessarily mean you're less healthy than me. It just means you notice.
Right. Okay. Thank you.
hmm Uh, we have a question in the chat here. Thank you, Kathy. Let's see. It says, do you have to wear safety goggles if using red light on your face? I have a Mito light and used it last night on my face. So I'm not familiar with the Mito light product, but yes, in general, therapeutic devices are going to come with green goggles or green glasses, which block the red light. So like my lasers came with green glasses so that if I'm doing someone's face or head for head injury or something, we put the goggles on so that to protect them. That's probably more of a liability thing for the companies than it is really going to hurt you. Obviously, you don't want to hold a laser up to your eye for a long time, but there are actual therapeutic uses where you do use it directly on the eye. But unless you're working with a doctor that's aware of how to do that, I would not look directly at it or point it in your eye. Kathy, if your device is, I've seen some of those face devices, they look like, the V for Vendetta mask, right? It's just this or a Jason mask or something with the red lights in it and the eyes cut out. Um, if they're like my lasers, if I'm lasering my sinuses, the red light is so bright that even with my eyes shut, it's really bright. So I'll put the glasses on and try and dim it that way. But if the glasses are too big so that they're encroaching on the area of your face you're trying to treat, you could pick up a pair of those small goggles that they give you in a tanning salon. So, like the tanning goggles that basically just cover your eyeball and don't take up any other area on your face.
Bartemus.
Yep.
Yeah, I just recently had a visit with my neurologist, and we were talking about my facial numbness, and I asked her, if she was familiar with the red light therapy, and she said that unless it is a medical grade device, it's
Mhm.
probably not going to do much good. And she said those are very expensive. Do you agree with that? Medical grade,
Uh,
yeah.
um, Not necessarily. There are commercial products available that can give you therapeutic doses. You just have to sit in front of it longer than, say, a medical grade device. That's the real difference. So, for example, you could use a red light, that in a presentation, a red light laser where I'd point at my slides with it. If I wanted to hold that over the area I'm trying to treat for like a week, I might get a therapeutic dose because it's not powerful, right? But if I use my medical grade laser over that spot, I get a therapeutic dose in 5 minutes or less, right? So it's all about the power that the device is putting off. And obviously medical grade devices are going to have more power because they're being used by professionals who've been trained by it and on it. But there's therapeutic devices on Amazon, or there's devices on Amazon that you can get therapeutic levels of impact from.
You had sent me a link, and so I'm assuming that if you sent that link, you would agree that it's a good enough device.
Yes, yes, I like that device. I believe it was the
I
Huga
think
Light. So
so.
Huga Light is a good brand on Amazon. They've got red light devices, but they also have light bulbs that have the blue light end of the spectrum erased from them, so you can use them at night and not stimulate your sympathetic nervous system. So you can still, say, read next to your bed, but fall asleep and not be using a device that's putting off blue light and keeping your brain awake and inhibiting your melatonin. So Huga Light is a good company. I have a couple of their book lights. I have a couple of their light bulbs. I don't have their red light device because I have my own lasers, but I've had multiple patients pick it up and they've liked it, and they've had skin conditions that it was very useful for.
Yeah, I've seen advertising for the ones that wrap around.
Mhm.
I think that you can wrap on your face or somewhere on, I don't know.
Yeah, face, leg, and anywhere. Yep,
Would that be a good option?
possibly. You just have to look at um, the device and the power and the reviews and things like that. And you could, if you don't know, if you don't know if its power is any good, you could look at its power, its technicals related to power and output next to, say, the Huga Light device, or a device that is well known. And then, if it's got similar power, then it's probably going to be able to give you therapeutic results.
Okay, thank you.
And so the wrap on would be good because the closer to the body part, the light, the better, right? So if you can literally hold it on your face or hold it on your knee or whatever you're trying to treat, or my bicep tendon, say, or over the bicep tendon, then that's going to be better. The further, if you have one of those big panels, the more space between you and the panel, the more the light can be diffused in the air as it's traveling towards you. So ideally, it'd be laser to skin for the treatment. So if you can wrap it on you, that's as close as you're going to be able to get it.
Do you have any brand recommendations for a near infrared sauna? Because we were thinking about getting one of those as well. But I want to make
Uh,
sure that it's a good one. I don't want to spend that much money on something that's not going to work.
yeah, I don't, sorry. But one thing you want to know for sure is make sure it's near infrared and not far infrared. And the reason for that is, you can see here, near infrared is a different wavelength than far infrared. And near infrared is much more physiologically beneficial. There's many, many more studies on the near infrared. So you'd want your sauna to be near infrared. And then it's questions of power. And it used to be that the ones that had enough power, you'd have to put a different, you'd have to run like a different electric source to your house because
Yeah.
it was a different power. Um, Sorry, I'm ignorant I'm not an electrician, so I don't know how to talk about it correctly, but you needed more power.
Yeah, I've heard of that.
Now,
I've heard that before, so I know what you're talking about.
okay, but now I believe there's devices that can run off standard outlets.
Okay.
So again, you might have to do some more reading and maybe you come back and fill us all in on that.
And you said 800 to 810 is the wavelength. So I would need to look at, I'm sure it would say that on there somewhere,
So
wouldn't it?
yeah. So well,
Okay.
yeah, near infrared is going to so near infrared is going to be basically 760 on up uh until you hit far infrared. So like 760 to 1400 is what we're trying to be between. But when you're doing research on near infrared for depression or anxiety or head injury or whatever, they're mostly in that 800s range. So it could go as high as 880, but you want to be between the 800 and say 800 and 900.